The month of December was one of the worst months in Maryland for COVID-19 infections and deaths. And tonight the concern is the Christmas and New Year's holidays could make January an equally troubling month. Joining us right now is Bob Atlas, the president and CEO of the Maryland Hospital Association. So Bob, what's the status of Maryland's hospital capacity right now?
Well, it's about the same. It went down over Christmas, but right now we've got about, really for the last couple of weeks, we've had about 1,700 COVID inpatients in hospitals, plus or minus 50. Today we're at 1,756. We've got about 5,500 non-COVID inpatients in hospitals, which is a good number. Means people are getting the care that they need, and we've got about 900 staffed but unoccupied beds. So we have capacity to take more, but that's a little less empty space than we've had in the earlier part of December.
You said you have some room for more. How much more are we talking about?
Well, we have 900 staffed but unoccupied beds. So
Okay.
we're at about 89–90% capacity of staffed beds. You know, we have many more. We have about 1,000 plus more physical beds. So if we can find the staff, if needed, but we have not really topped over that number. And we think that with the Thanksgiving bulge having sort of passed, that, you know, it'll be a while till we see another spike. The post-Christmas spike should appear sort of mid-January.
Mid-January. Okay, so you're saying that we're about 89 to 90% capacity right now. So let's talk about that staffing right now. Are we in danger of any hospital staffing shortage if there's a surge?
You know, that's always a possibility, but we're planning well. Our hospitals are doing a lot better than in many other states that you see on the national news. We're not in that kind of crisis mode at all. We're managing the load, and we're keeping our staff protected and healthy. And, you know, thankfully, many of them are now getting vaccinated. So we're excited about that.
It's always exciting to hear that Maryland is doing much better than the rest of the country. And right now, Maryland continues distributing vaccines among the members of its Phase 1A group, and that includes healthcare workers, as you know. So how is that distribution going for hospital employees?
It's going, you know, with the Moderna vaccine just arriving the day before Christmas or 2 days before Christmas. It was a little hard to, you know, schedule the clinics for staff and then get them vaccinated right when, you know, some people were taking off for the holidays and the like. So that's, we're building momentum this week, and I think you're going to see very substantial numbers of healthcare workers vaccinated. There's a lot of excitement. Seeing videos being put out by our hospitals with workers really excited to be getting to this point.
So are you hearing encouraging news about the number of hospital staff getting vaccines right now?
You know, it's in the single-digit thousands right now, and we expect that to climb markedly in the next few days, even as we get through into this week. It was a little slow going just to you know, get the things arranged. Everybody, the hospitals didn't really know exactly when the vaccines were going to arrive, and so they weren't able necessarily to set up those vaccination clinics as fast. But we have some hospitals that have, you know, gotten at least half their workers done already. So it's not a bad start.
So a slow start, but we're picking up speed.
Definitely picking up speed, a lot of excitement, and you know, we're working very closely with our state health department. They're doing an excellent job of allocating the vaccines to hospitals and as well as to long-term care facilities. And you know, I think we're going to have a good launch here. It may not be as fast as some of what people thought. You know, national numbers of 20 million. We know that that's probably not going to happen. But by early January, we should be in very good shape using the vaccines that we're getting into the state.
All right. Mr. Atlas, Happy New Year to you, and thank you so much for joining us.
All right. Thank you, and Happy New Year to you.